The LPNs have developed quite quickly and quite dramatically. They've only had less than a year to make the mark, and already the LPNs are showing some signs of really getting to grips with some difficult problems.
Local professional network chairs play a real integral role for clinical leadership across pharmacy, dental and eye health, not just in terms of locally addressing inequalities and ensuring better outcomes for patients, but also they play an integral role in shaping the national agenda.
The LPN network is very important for the developing of pharmacy services. The LPN has helped, as one of its key work streams, has developed an improved self-care for patients.
Without the network, there's a real vacuum and gap between the commissioners, be it NHS England or the CCGs or Public Health, the providers, and actually the wider community pharmacy family. I think the network to me is the glue that actually holds all of that together.
Quite often in optometry, like pharmacy, you can work in a silo and not be aware of what your other professionals are doing. And this is an opportunity to get together to discuss and to come up with fresh ideas.
We are in a period of change, and we're also in a period of financial austerity. So what our ambition is to be able to provide good, high quality, safe dental services without increasing the budget. And this is going to need a lot of cooperation between providers, performers, commissioners and the public.
In the past, we've all collaborated in an informal way, but for the first time really since I started in my career in dentistry, this has formalised that. It's got us all round a table on a formal basis, talking, collaborating, sharing good practice and really finding solutions to the problems that exist within the dental services sector.
Dental LPNs have been really active locally in terms of a few of the initiatives we've had, the call to action that came out early this year, lots and lots of really good local events where the dental LPNs have managed to organise all the key stakeholders to come together and actually give forward their suggestions around the call to action. And this is really where dental LPNs show their worth.
Whilst we might have small beginnings, I think will be crucial in terms of commissioning, giving opinions to NHS England, helping the local services, also interacting with GPs.
There's been a recognised problem with too many oral surgery referrals going through, and this has put a lot of strain on services. We've been working with providers and with general dental practitioners and hospital trusts in order to set up a new set of guidelines which are very, very shortly to be distributed, and these should help to solve the problem. And this is an example of cooperative working.
There's people who need treatment at home, so they need domiciliary care. And those again are people that we're getting more referrals of, and we want to look at the numbers and the sources to look at how best to meet the needs of those people. And I think working with general practitioners with those two groups is vital. We haven't really had a formal opportunity to do that until now.
They are the if you like, the clinical champions at a local level to make sure that we actually are delivering the best services for our patients.
We've worked with Pharmacy Voice and the Royal Pharmaceutical Society to bring the chairs together so they have their own network to support one another in these new and emerging roles. At the last meeting we heard from a number of our chairs around the work that they've been doing locally, and it was tremendous to hear the breadth of work that they've been doing and some of their real great achievements in such a short space of time.
Down in Newquay, they've actually had a situation where a patient that was discharged from a community hospital needed some support with their medication, and that identified a need in terms of when a patient's being discharged from a community hospital, it would be really beneficial to have some pharmacy support. So what they're piloting at the moment is a pharmacy technician who goes and joins the multidisciplinary team meeting when they're thinking about discharging a patient. And that pharmacy technician makes sure that everything is put in place to support that patient around their medicines when they're discharged. So making contact with the community pharmacy and making sure they have any support that they need with their medicines when they go home.
The challenges in eye care are huge at the moment. It's a real high volume specialty, and we have challenges getting patients to be seen on time within the hospital setting.
One of the ideas we've been implementing in Greater Manchester is the minor eyes condition scheme. The optom can actually produce a sign order which is sent to the pharmacy, and the pharmacy dispenses the item straight from there. So it saves the patient having to go to the GP practice for a prescription, and means they can go seamlessly from the optometry practice to the pharmacy and receive that medication free of charge.
The eye health chairs in the south have been working together to share resource using Dropbox, such that we can share ideas, presentations, any material that we would think would be worthy of being used elsewhere. That's had such a success that in fact now we've been asked to share that with the rest of the chairs within England.
I've set up the minor eye condition service in Haywood, Middleton and Rochdale, and to be able to share that learning across the area is going to be invaluable.
We're looking at dementia and sight loss, and dementia is a big issue nationally, and it's also a big issue that our CCGs think is important. It's a way that we can bring the whole of the sector together.
One of the things that we're trying to do within the local eye health network is organise pathways within certain conditions, such as the cataract pathway, the minor eye conditions pathway, and other more specific pathways within certain eye conditions, and then commission those services as one tender for the whole of Greater Manchester. Now that saves a lot of money, but also a greater patient experience across the whole of the area teams.
Where we are talking about sort of management in the past and how primary care has been delivered, it's too often been dictated or devised by people sitting away from the front line. Getting clinicians involved in that is going to be critical. One of the key things that we want LPNs to really major on is to start tackling health inequalities. In the NHS today, we still have such wide variations in access, in delivery, in outcomes, and actually local professional networks really need to be able to make sure that they put that centre stage.
I think it's up to the commissioners working with LPNs to make sure that they target those inequalities. So it will be a joint collaborative partnership between the commissioners and LPNs and our professionals.
We're trying to target the resources at those in greatest need, and I'm not sure that we've got that right yet. We've certainly asked our managed clinical networks to think about what's the problem that you have to address in your particular specialty area. You know, where are the issues and what would you do to improve them? And by doing that, we're hoping to actually get the voices of people, you know, on the ground closest to the problem in helping to come up with solutions.
In the future, I'd like to see even more clinical engagement. I think with co-commissioning at the moment, I think it's so much more valuable to actually get clinicians to give their advice. We are meant to be working in a patient-centred NHS with a patient focus, and where the people who see patients day in, day out and can perhaps understand more of what they need, with our advice, it can be improved even further.
The key aspects of inequality within optometry is reaching those hard to reach groups that are more at risk of certain eye conditions. Diabetic patients, ensuring that they're all seen annually for their eye checks, getting the importance of that message across. And then there's the people, the Afro-Caribbeans with more at risk of things like glaucoma. It's, well, how do we entice them into coming for more screening services, to look for these preventative healthcare, being able to detect these conditions before they are causing visual problems.
And we're developing a library of resource so that where we've done something in one particular area, we don't have to reinvent the wheel in another.
The LPN network is fundamental to the way we're going to work in the future. We've already demonstrated how we came together in providing a pan-London flu vaccination service, and that was because we had communication links with colleagues across London, and the LPN was fundamental to that.
The LPNs, I think, remain a really crucial network to bring together a number of health professionals who traditionally haven't been involved in commissioning. Doctors and nurses have had lots of influence, but not the other professions, and this is their opportunity now.
I can't really see the commissioning process working without them, and they have an important role in involving patients and the public in what we do. Sadly, that's lacking, and very often when you hear what the public are saying, it's not quite what we're thinking. So it's very important to get that feedback from the public.
we all recognised that we'd experienced putting in bids for research grants. So we weren't really experienced in how to write the bids and be successful. So we worked with our local academic health science network, and they've agreed to host an academic hub for pharmacy for us. So that's going to really support us with our bids for research grants.
Since the local health network initially developed, there's a big clinical emphasis on how services are delivered, and really put the patient at the centre to see, how does that impact the patient, their journey, their access.
Different stakeholders have different priorities, but the LPN chair must bring together the different stakeholders for the key priority, which is better patient care. We need to keep the patient at the centre of our focus.